So this morning we're kicking off, we have a huge treat for you. We have Atalaya Sergi. She leads the AmeriCorps Seniors Federal Grant-Making Office. And we, as a program and as an agency, Lifespan of Greater Rochester, are so fortunate to have been awarded one of two initial senior demonstration projects, bringing volunteerism to workforce. And we are thrilled. We work in 6 counties of New York, and we're working to build that program. But I'm going to tell you a little bit about Atalaya. The AmeriCorps Grant-Making Office is focused on promoting and engaging people age 55 and older in outcomes-oriented service. She has more than 20 years of experience in service, community engagement, and education, working in the public and nonprofit sector to bring private and public organizations together to ensure people of all ages, as well as those living in underserved communities, thrive. So we are absolutely thrilled to have her. So with that, I'm going to ask you to give her a warm welcome.
Thank you so much, Doris. And good morning, everyone. How are you doing? Great. You know, I was just talking about how nice it is to see so many people so early on the last day of the conference. I heard y'all had a dance party yesterday. I'm sure some of y'all went out last night. So it's really nice to see all of you here. And thank you for having me. This is my first visit to Albany, and I got out just a little bit last night to get some dinner. I think I'm going to have to come back when I have more time to explore. So I hope you all had a good time on the dinner cruise and all of that and got out to explore a little bit, but it looks like a really lovely city, so I look forward to coming back. And I want to thank you, Jill, Lifespan, the conference team, for just having me this morning to come and speak to you. I'm what I think is an unusual suspect, so I'll talk a little bit about that a little bit later. But thank you for inviting me. It really is, to me and to my team, when I told them that I was coming, very significant that you all invited me. As Doris said, you know, I oversee AmeriCorps Seniors, and we are in the federal agency of AmeriCorps, which is we're volunteers. That's what we do, national service and volunteerism. So it does speak to the fact that you all really think that we have something to offer and a way to help you all meet the mission, do the work, and take care of families. So thank you so much for having us and having me here. So let me make sure I use this clicker. Okay. Did it go? Okay. So as I said, AmeriCorps Seniors sits in the federal agency of AmeriCorps, which is our nation's agency, which is tasked with stewarding volunteerism and national service domestically for our country. My office fulfills that mission by making grants to local community organizations to engage people 55 and over in service. And we make those grants to state and local agencies, nonprofits, tribal nations, faith-based organizations. And we do that so that those older adults in those communities can be engaged in the community, and it's both good for them and for their community, the service they give. So we have 3 signature programs, as you can see there on the screen. The Foster Grandparent Program is an intergenerational program that partners older adults with children and youth. And volunteers really support those children and youth to build their academic and social emotional skills. And they're typically with them for an academic year. But some of those volunteers that I've met have been in their same schools or same after-school programs or same boys and girls clubs for 20 years. So they really stay in there committed to the work. The second program is RSVP, and RSVP provides numerous services in the community, and it really allows older adults to kind of pick what they're interested in, what they might have skills to do, and then be able to serve in those areas. And so they do things, everything from food security to benefits and resource navigation. So they may work with some of the people that you support. They also do things like investigating scams and fraud. They serve military families and veterans, people who are unhoused. They also work with individuals to help them get job readiness skills. And that's just the ones that I can remember and wrote down in my notes. They do a lot of other things, just whatever the community needs. And then there's our Senior Companion Program. So the Senior Companion Program, it is their 50th anniversary this year. We're excited about that and going to be celebrating them throughout the year. But this program supports older adults and those with disabilities to live in their homes independently. They do things like just help them stay connected to community, provide companionship, maybe take them out to get their groceries. But the other thing that they do is they provide respite services for families. And like I said, their respite services are really focused on companionship. And they help with small things like, maybe they will serve a meal or make sure someone eats their lunch. They may help them to get to the grocery store if they need to do that. Get out of the house, take a walk, like those types of things that they do to help support respite. And they also develop meaningful relationships with caregivers and really help them to know that, they have someone who is trusted that's going to be there. Through that service and through that program, we found out that there are some really good benefits for that program. Okay. So we did a 3-year longitudinal study with JBS International, which is a research group. And they gave us some evidence that the respite services that our volunteers were doing really did have some impact. So part of that study, we asked caregivers who were receiving the respite services, does the Senior Companion Respite Service matter for the health and well-being of the caregiver? And we classified our caregivers into 2 different groups. So the first category were high-level caregivers who were rated as high-level. So they needed both respite services, household management services, maybe some behavioral services, supports, and other things that they requested. And then the second group was a moderate level, and those were caregivers who just really needed some respite services, just the basic respite services. So the objective of the research said learning about the types of services caregivers received and their level of satisfaction, and then also what change in health did they see in caregivers who received the respite services. So the study surveyed caregivers prior to the start of the respite care, of course, and then again at a 1-year period. And we learned that in 1 year, 76% of those moderate level caregivers ranked their senior companion volunteers high for providing them with personal time. 60% that were in the high level ranked their volunteers as helping them with personal time and management. And like I said, the lower percentage between the moderate level need and the high level need caregivers wasn't something that really, I guess we were surprised by, because our programs don't have, they aren't there to really provide that in-depth respite services that would help with like household management, behavioral management, and then other requests that caregivers need. And that's, to me, the difference between when we have a volunteer program that's providing this and when we have paid staff that's providing it. But we did see that 90% of the people who received respite services from our volunteers were satisfied with that and really felt like the respite services helped. So I tell you that to tell you a little bit about the volunteer service that we provide, and that'll bring me to the workforce piece in a second. So another highlight of the study was that caregivers reported that their health and well-being improved. That was particularly true for those who started out, saying that their health was poor. Approximately 40% of those who rated their health as fair or poor to the respite services really saw an improvement over the course of that year. And also, because these services are free, one of the things that we noticed is that we were capturing people who were falling in that gap. So they couldn't pay for respite services, but they also couldn't, they weren't eligible for any kind of state insurance, federal benefits programs to help them with their respite services. So in that case, in that sense, we feel like the volunteer services really did help us kind of expand the reach and expand the number of people who could receive respite services at some level, and with background checked, somewhat trained volunteers, background checked, they could be trusted, and would give them some relief even if they couldn't afford it. Okay, so that brings me to our fourth program. So we have a fourth program within AmeriCorps Seniors that we don't talk about a lot, but it's called the AmeriCorps Senior Demonstration Program. And that program allows the director, whether it's me or anyone else who sits in my seat, to really be able to test out new ways of doing service and expand to new areas of need for service. So AmeriCorps Seniors is both tasked with serving the community, but also serving older adults. So that allows us to really be responsive to kind of emerging needs through the Senior Demonstration Program. And with those national needs that we saw coming up, I'm going to share some quotes, some statistics with you, but you already know them, you live them every day. It'll just help me kind of bring you from why a volunteer organization and office would end up wanting to do workforce. So Family Caregivers Alliance has noted that there are 43.5 million caregivers in the U.S., and that 85% of those caregivers are taking care of their relatives or loved ones. This, for me, is a story that I know well. So these are some throwback photos that I found on my phone. So my father was a caregiver for me and my sister at the same time that he was a caregiver for his ailing father. My mother died unexpectedly. So in that first picture, that's me, my mom, and my dad. My mom died unexpectedly from complications of an asthma attack. And I was 12 and my sister was 6. So my dad became the sole caregiver for 2 little girls unexpectedly. Within a year or two of my mother's passing, my father learned that my grandfather was in a really dire situation where his health and care was not being taken care of. And so he went to get my dad went to get my grandfather to bring him home to live with us. So the second picture is me and my sister, and then the third picture is my grandfather. So I am not really sure as an adult still, and my dad doesn't talk a lot about it, like how he actually did that. When he was going through his own grief, he had a full-time job that he traveled in, and so eventually he actually started his own business while doing all of this as well, because he knew he needed to be home with us and have much more flexibility in his schedule. I know that I wish that he would have had some respite support. He didn't. I know it would have been helpful to him just to spend time with his friends, to have some quiet time, to go get a haircut, because he loves to get his haircut, and not have to wrangle me, my sister, and my grandfather. And the third picture is my grandfather. And that look on his face, when I found this picture, I was like, that's the one I'm going to put up there. That look on his face is very mischievous. So you can imagine, my grandfather was really no help at wrangling anybody when we were little. So I wish that he would have had respite support and he would have known about it and would have taken advantage of it. So fast forward a couple of decades. So when we were little, my aunt moved across the street and she helped my dad with us as best she could. A couple of decades later, my aunt became the caregiver for my grandmother. My grandmother is the last picture. You can tell because she has her white church purse. She is not like my grandfather. And that's my paternal grandfather and my maternal grandmother. So they were not married, which was probably a good idea. So thankfully, my aunt, who was a nurse at the time that she became a caregiver for my grandmother, she knew about supports for caregivers. And she kind of created a different model for our family of what caregiving could look like. She did access resources, and she had in-home respite services for my grandmother. And even today, my aunt still talks about how she was so thankful that she had that it helped her with her mental health, helped her with keep up with her physical health. It gave her the opportunity to do, stress-reducing activities that she enjoyed. She is a big thrifter, so she likes to go to all the different cities where her favorite thrift stores are, and that is what actually does reduce her stress. So she could still go on the weekends to do those things that she loved. The other thing was that it gave my grandmother someone other than her family to talk to. My grandmother lived well into her 90s, and I would say by the time I got to the end of my high school years, all of my grandmother's really good friends had already passed away. So she was mostly surrounded by family. So I think the respite services also were good for her because it gave her someone outside of the family that she could talk to. The other thing that I noticed too was that it allowed my aunt and my grandmother to be mother and daughter. Sometimes their interactions became care provider and patient. And I feel like respite also helps, respite services also help families to hold on to some of the family dynamics and that relationship that can get lost for caregivers when they are really having to work with their loved one in a whole different manner. So I'm just really thankful for the services that she was able to access and that she has now created that model for my family that we can ask for help, and she's helping us to understand how we do that. So I'm just really thankful for the work that all of you do. Okay, so we talked about that national need of helping support our caregivers and the work that you all do. The other emerging need for older adults that AmeriCorps Seniors is also charged to take care of is really around the need for work. So today, it's different from 65 years ago. So the Foster Grandparent Program was the very first AmeriCorps Seniors program, and it started in 1965. So different from that time to now, we see a lot more older adults having to go back to work or choosing to stay in work during times when we would traditionally think we would see them retiring. The National Council on Aging also says that more than 17 million older adults aged 65 and over are economically insecure with incomes below the 200% federal poverty line. In addition, as a nation, we expect that 23% of our population will be 65 and over by 2050. And because we are generally living longer, healthier lives, there's more time for people to commit to things that they want to do in their life. The older adult population is also becoming more racially and ethnically diverse, and we'll have one of the most educated group of older adults that our nation has ever seen as we go through this change. Sometimes I hear people talk about how the aging of our nation is a negative. I see it as an opportunity for us. I really do. And not just because I sit in this seat as the director of AmeriCorps Seniors. I thought that before I arrived. But what I think it is, it's a growing national resource and probably the only natural resource in our country that there is actually going to be more of, that we can really utilize these older adults to help us. They are increasingly able, available, and capable of helping us with our needs. So I know that they are there and that they want to help because AmeriCorps Seniors has about 143,000 older adults that are participating with our grantees across all of our programs every year. And we do that. They are serving in every state, the District of Columbia, 3 of our U.S. territories. And last year, I had my data team poll. Last year, they provided 27 million hours of service to our nation. So the way our nation needs are changing, the way that older adults' needs are changing, kind of converged for me in 2022 in an idea for a senior demonstration funding opportunity. And it was focused on using national service as a pathway to professional and paraprofessional careers. So essentially, we are trying to create a workforce development opportunity for older workers, but still coming through a service kind of lens. And the model that we chose to focus on professional and paraprofessional jobs because when we talked to the Department of Labor, who has the CSEP program that I'm sure all of you know about, the Senior Community Service Employment Program, they said that they don't really focus as much in that paraprofessional, professional, full-time job area. So they thought that'd be a great thing for us to focus on. So we are happy that we have something we think that we can add to the opportunity for older workers to be able to find careers in areas of need. So we also wanted to target areas that allow for some professional development. I think I forgot to click. Yeah, there we go. To allow for professional development and economic security for older adults as well. And we definitely have to maintain our service aspect. So a lot of the programs use service as an opportunity for older adults to try out their professional career thing that they're working towards. It's a place where they can get experience, build certifications as well. I think also coming through service, it really helps to create kind of a supported environment for older adults to find work, to develop skills, to get experience. And then we also wanted to make sure that there was job placement. So not just helping the older adults to build their skills, but to also have them place them in jobs and help them to do that. Finding jobs today is very different from what it used to be, and it keeps changing every couple of years, I feel like. So, you know, if you've been out of the job market for a while, you may need that kind of support to help you. We also wanted to make sure that we removed barriers for participation. And this is a lot, just a learning that we brought over from our volunteer programs to this more workforce service to work opportunity. We have a lot of barriers around, financial barriers for people to participate in a workforce program. So we wanted to make sure that these volunteers that were trying to move into work also had a stipend. And the AmeriCorps seniors, the special thing about our stipend is it does not impact your income. So it allows people to hold on to their benefits, to hold on to the things that they need until they can secure a job where they can maybe, get benefits, earn a living. And so we wanted to make sure that that was available to them. And we kind of took a little bit of the framing off of what our normal stipend is so that people could increase that if they wanted to. We were also thinking about things like internet access, digital literacy, transportation. All of those things can be barriers for our regular volunteers, so we knew they might be barriers also for our volunteers in the Service to Work program. And then we wanted to also do this work because we wanted to combat ageism. And a lot of the ways that service is set up and how we see our younger people in some of our programs moving from national service to work, really some of the barriers that older adults run into in ageism, in the workplace, in hiring, we could really combat. So one of the data points that really stuck out to me when I was thinking about this idea was from AARP. So they did some research and they said that 62% of people age 50 plus in the labor force really face discrimination in the workforce. They feel like that is a real thing. And among them, 93% believe that age discrimination against older workers is really common. Roughly 32% of older adults in the labor force report that in the last 2 years, they have heard negative comments at work about their age, and 17% say that they were the recipients of those negative comments. So in addition to, all the things that you can get in a workforce development program, we really felt that having someone that can speak for you, having a safe and supportive place where you can build your skills and get support in our service programs would really also help to combat some of those issues around ageism. In national service, as I said, workforce development and career pathways has been really a staple with our programs in the offices, my sister offices, that really focus on young adults. No one had ever tried this with older adults, so this is like a new and adventurous thing for us to try this and to see if it will support and help older adults as well. And so as we kind of get started with this, we are really happy to have our Lifespan of Greater Rochester be one of our 2 programs that really launched off in 2022 with this idea. When we found out that there might be some interest, we were really excited because as you saw, I understand by living in the family where I've seen the 2 examples of having respite support, not having respite support. We had the research from our senior companion program to say that this is really impactful. We were really excited to see them as one of the organizations that wanted to get started with this program. I really am grateful for them because, like I said, we've never done this, and they are kind of walking through this with us and learning. Some of the things that we're learning with them and with some of our other programs is also how we can support our grantees better to get started in thinking about the development of workforce models that are different from what maybe has been done in different industries before. We really want to learn what are the best ways to set up our programs. Are there, a particular segment of older adults that we should be recruiting to the program? But I think together we will be learning a lot, and I am thankful to them because they have really iterated on their program. They've found things that didn't work and changed and maneuvered and are doing that. So we're really excited about that. It's really exciting also to really think about how older adults can be a part of the respite workforce, how we can recruit them to bring their skills, their knowledge. One of the things that we see with our older adults that is different from our young people, they've already worked, so they bring some of those soft skills, like you need to show up on time, you need to be, appropriately dressed for whatever the work it is that you are doing. They know how to interact with people, how to ask good questions, how to listen really well. And those are things that we teach our young people to do, but they come with those skills already. So I feel like they really can be a part of this building the workforce that we need to do to support our families and through respite. I know that AmeriCorps Seniors is an unusual and unexpected suspect in this whole workforce development area, but I really do think that we as a national service organization and an office that focuses on older adults can bring something to the work that you're trying to do and really support in this space. So I am thankful that you all had me come and speak, but also very thankful to Lifespan that they put in an application and we were able to support that. So in addition to workforce, because AmeriCorps Seniors is, we are really committed to caregivers. And I know you heard from Allison and Greg yesterday. So we've been working with them a lot and working with ACL. They are a really strong and long-time partner to AmeriCorps Seniors. So in addition to the workforce development, we are also a part of the Health and Human Services Interagency RAISE Council, working on the national strategy to support caregivers and trying to make that come to life now that we have the strategy. So I sit on the council. Jan Newsom, who's on my team, she is my partnerships manager. She also participates in one of the work groups as well. And we're focusing our efforts to help to try to bring awareness to the role and needs of caregivers. So we are working to integrate caregiver supports into our priorities and service activities where it's appropriate for our programs, and that's mostly in our Senior Companion and our RSVP program. Though for our foster grandparent program, we make sure that they have resources, they understand what's out there to support caregivers, because they may need that themselves, but we've also found that with all of our programs, they share that information. Our volunteers share that information with their community, they share information with their families. So if we can even equip our foster grandparents with this information, they can take that out to their community. So we're just trying to make sure that they have that information. We're also trying to use our national platform to be able to tell the story of caregivers through our volunteers and the people that they serve. So since this is also a Senior Companion's 50th anniversary, we've been doing a lot to share the stories that our volunteers have, which also then share like how they are supporting caregivers and lifting up the needs that they have. And later this month, we're going to have a virtual kind of convening where we're going to invite some of our Senior Companion volunteers to talk about their work that they do, how they are reducing social isolation for themselves, but also for the clients and the families that they support. So we're going to try to continue to do that work and lift it up. And then the workforce opportunity was a good one for us as well, to be able to support caregivers in looking for ready, willing, trained respite providers through that workforce development program. So I hope that as you think about your work, that you might consider, how national service can help you. I'm here representing the AmeriCorps Seniors Office, but there are 4 other programs within national service that do different types of work, that have funding opportunities to support. One of those is VISTA. It's a capacity building. So if you need capacity building, that might be an opportunity for you. And then there's AmeriCorps State and National and Public Health that also support through grant making opportunities. So just think about us. I hope that, having AmeriCorps seniors be a part of your world and a part of your family, that you kind of can think about how else might they help us over there at that federal agency that I pay my taxes to have them give out grants. Just saying. So that is all of the information that I wanted to share with you, just to let you know what is national service, what is AmeriCorps Seniors, how we're thinking about how we can support the respite work that you do, support the needs that caregivers have, and just to talk a little bit about how we went from just being a purely volunteer organization to really thinking about how we could use our workforce funding opportunity to support respite and to help build out the workforce. So I made this short on purpose so that you would have a little bit of time to ask me questions if you have any questions. Hey, yeah, I can wait.
Okay.
I'm a trained social worker. You
Okay.
just wait. Just wait for
Thank you.
people to think.
I'm Megan Schwam. I'm the executive director of the Tennessee Caregiver Coalition in Nashville. We have a senior companion program and a senior demonstration program, like COVID related. We are super excited to hear about this program. And as we were talking, we had a question. So for our programs, they're low-income seniors. For this senior demonstration program, are they low-income seniors? And then how do they transition from, our volunteers love that stipend doesn't count as their income because they can stay in their low-income housing. And our concern is how we would recruit folks because they would go from their low-income housing to a job where they're making money and then probably can't stay in their low-income housing because of that income. But
Yes.
paraprofessional and home health care jobs don't pay enough to actually afford rent in Nashville. So how do we help address that in recruitment?
So for the workforce development projects, we did not require them to only recruit older adults who are below the 200% poverty. That's the income level that she's mentioning. For our foster grandparent and senior companion programs, the older adults who receive the stipend have to be within 200% of the federal poverty level. We did not keep that as a requirement, but we did ask them to focus their work, focus some of their spots and opportunities on people from lower income communities or have lower incomes. And all of our grantees are really working to do that. So we are thankful that we could kind of release them from that, but also that they are still committed to that kind of work. And then with the stipend, they were able to also increase the stipend above the small $4 an hour that still haunts me every night for service hours. So they could do that. They could increase that, or they could create slightly different incentive models that helped financially. Yes, it does mean that if those older adults do get a job, that they may not be able to receive all of the benefits that they had before. And that's why we've kind of thought about, like, this might not be the opportunity for every older adult. Some of them may not want to go back to the workforce. They may not feel like they can do that in their local area. But we wanted to have this opportunity for those that could. And I think that is a bigger national issue that we have to think about, is that people who work in their communities can't live in their communities. And that's also why we chose to try to focus more on the paraprofessional and professional, in hopes that they would be able to receive a livable income and have some financial security. Other questions? Yes.
Hi. My question is in regards to the foster grandparents program. As far as I know, they provide services at school. Well, that's how we have in Delaware. I was wondering if that program could be expanded, and if that's possible, they could provide lifespan to specifically for the population with the intellectual development and disability development.
Yes, so the foster grandparent program can definitely serve those communities. And we've been, I think COVID really has brought to light that we need to, in foster grandparents, we also need to stretch out beyond schools. Because it's really hard to get into schools right now to do volunteer opportunities, because they are still struggling to find their footing and to keep their teachers and recruit teachers. And so sometimes they don't have the bandwidth to support the volunteers like they did before. So we are encouraging our programs to think about other areas where there are children, youth that need support, and to branch out beyond that. So there's a program in Kansas that I got to visit, and they work in a organization that focuses on supporting cognitively children who have cognitive issues or physical issues as well. And it's not a school setting like the traditional school setting, but they do work there. And that is the population of children and youth that was the original sole focus of the foster grandparent program. So when it was developed in 1964 and then launched in 65, that was the group that they were really focused on supporting. So it's not something you can't do, but every grantee gets to choose, where they want to focus their efforts. So maybe bringing them an opportunity, they might think, oh, well, if we have a partner, maybe that is something that we can do. Other questions?
Good morning.
Good morning.
Thank you for joining us and for kind of spurring our imaginations around workforce development. I think that is really great. I love that your connections within the system with ACL and the Department of Labor. Wondering, are you connected with HRSA, the Health Research Services Administration, and their geriatric workforce development initiatives?
I don't think that we are in any of those conversations right now. Though HRSA is on our radar, but we have not been on those workforce work groups and anything like that at this moment. But thank you for an idea to look up. And sometimes Jan is on things that she hasn't told me about yet, so she may be.
Yeah, in the workforce development grant opportunities, they do include caregivers as a component of the workforce and community health workers, so I could see this being a really interesting connection. A question for the audience, and then one more for you. Is there anyone here from the HAP Foundation from Illinois? I would love to learn more about what you're doing to support community health worker development, or anyone that's familiar with that program, or I can go to your website, I'm sure, and find out more about.
Yeah, if you go to the website, I'm sure somewhere on there you can find my email, or I have cards, I can give you a card. I can definitely connect you with them. They are a newer program as well. Their grant didn't start until 2023, so they just launched. But I can connect you with them as well. And I know that they are doing some training and supporting of older adults to become community health workers, and they focused on particular communities where they felt like they weren't able to really connect with people, get any inroads into communities. So they were really looking to recruit older adults from those communities to help serve those communities.
One more question for you. I have not personally experienced this, but what I hear on the street is that some of the paperwork around AmeriCorps is pretty arduous.
It is a federal grant. So I would say that it does require some effort and time because it is a federal grant. Okay. Did you say it is as bad or not as bad? Okay, great. We are trying to work on streamlining some of the processes. So one of the things that we have done in AmeriCorps Seniors is actually we eliminated a whole report because we realized that at some point in our history, somebody must have used information from that report, but nobody was using any of the information now. So my data lead person was like, I don't think we need this. So we've been able to do that. And then we're thinking about our programs are funded, we are committed for a 3-year period. And then you can do a renewal of your grant. But in the 3-year period, the initial, we have what we call continuation. So we're trying to reduce some of the things that we ask people to submit in that continuation period. So we're trying to work on it as an office and as an agency, but it does require time and effort to do all the paperwork. The other thing that I will say is that my team has been developing more training and support pieces to make that a little bit easier. So when we say you have to have X policy, they are trying to develop some samples so people understand, like, what exactly are you asking for? So try to make, like, the paperwork you do have to do and the things you do have to have a little bit clearer so that you can, like, do it and get it done and move on with the work. Other questions? Yes.
So I'm just gonna follow up with the humor in the room. So
Okay.
the rumor has it that AmeriCorps grants are more favored towards the states with bigger population than the state with smaller population. Is that true?
I don't think so. I've never heard that one before. I don't think so. I'm trying to think through, like, why would that be? And I don't know that we are more favorable towards them. I don't think that's true because we do have a mission to serve everybody. But it may be that states with more populations have more applicants. And so percentage-wise, maybe they end up with more grants. This is just me, Atalaya, not as a director of AmeriCorps Seniors or a representative of the administration, thinking through like how that might happen.
Maybe the word favorable was not the right word.
Okay. Yeah, we are, in our office, as we go into our continued grant making and getting ready for our largest competition, which is within our RSVP programs, we are looking at, and we do keep an eye on, like what our footprint is across the country. We also try to look at where we're not, that we are also serving rural communities, we're serving our territories. So we try to keep an eye on that so that we don't inadvertently end up not serving somewhere that we need to make sure that we are serving as, you know, as an agency that is supposed to serve our entire nation.
What kind of advice do you have for people who might be considering applying for an AmeriCorps program grant for the first time, like things to consider before starting that process? Just kind of, how do you get started?
So prior to this role, I actually was a part of a national nonprofit that had three of the AmeriCorps grants. So I oversaw a foster grandparent program grant and the staff that ran that program. And I also oversaw the California Volunteers Grant. At that time, I lived in California. So the things that I would say before you apply for a grant is really understand what is your need. So that when you look at the different options that AmeriCorps can offer you, you can work with the regional team that would support you to understand which of the options is the best fit for you. And what helps them mostly is for you to come with like detailed understanding of what your needs are and where you want to see if national service can help you. The second thing is that regional team. Is if you're thinking about an AmeriCorps grant, and you're not sure if you want a state and national grant, a VISTA grant, an AmeriCorps Seniors grant, you know, that you sit down with a regional representative and have them talk with you about what you're doing, where you are, and what your needs are. They are really helpful in kind of maneuvering through which of the streams of service is what they call them, that would be best suited for you. And they can look at like, what are you trying to do, but they can also look at like where you are as an organization. And then come to the calls. So every one of the programs has a call for anyone who is interested in the grant. When the opportunity opens, they host a series of calls. And those calls really give you a sense of who our agency is, what our expectations are, what our agency priorities are, because we have a set of agency priorities that go from whatever administration to the next administration. And then they can also talk to you about what are the priorities of that particular grant making opportunity. But they walk through the whole entire notice of funding opportunity because, again, it is a federal grant, so it is long. They will walk through that and talk through all the pieces. They hold office hours to answer specific questions that you might have. They go over what a performance measure is, what are all the pieces of the budget that we would ask you for. So I would say really invest in setting aside time to join those calls or to watch the recordings of the call prior to applying. And then if you do apply, do not wait to the last moment to apply. We're in the midst of shifting our old grant-making system into a new grant-making system, but right now we're still in the old one, and sometimes it has technical glitches that require help to fix. So don't wait till the last minute to start putting in your information. Also, people who have never had a grant tend to run into questions as they start to put things in, and it gives you time before the deadline to really get some help and support so that you put your best effort into the system. You're welcome. Any other questions? Okay. So I think the last thing that I will leave you with is that this is the last day of your conference, and you are all here early in the morning to be a part of this last day. So you are the real go-getters out there. Thank you for joining me and for listening and for the great questions and the laughs. Love it. My public service announcement to you, though, is going to be make sure that you meet at least 5 more people that you have not met at this conference that you do not know before you leave today. The theme of your conference really demands it. We have to collaborate and advocate together as we raise the bar for respite and create and lift up best practices and strategies to strengthen caregivers. So we're only going to do that if we are all working together. So you got to meet 5 more people before 3 o'clock today. It's not going to be that hard. Thank you personally. Thank you for the work that you do. It has really made a difference. Like I said, the story I shared in my own family. And I see it continuing to make a difference in our extended family as our elders start to need more support, as the families, the different parts of my family also need more support with young people and older people to help them as they continue throughout this life. So thank you for the work that you do. And then on behalf of the Biden-Harris administration, AmeriCorps, and AmeriCorps seniors, thank you just for the opportunity to partner with you in the way that we can support you potentially through grant opportunities, but also just to partner with you in supporting caregivers, no matter who they're caring for, where they are, what language they speak, and what communities they are in. So thank you for that opportunity, and have a wonderful rest of your day.
One more time, a round of applause for Atalaya, please. So as I was listening to her, I just want to share a couple of things, because we are the first recipient of the senior demonstration program, and when I heard federal grant, I went, but I will tell you that I have never felt more supported by any organization for any grant that I have ever overseen, from the writing, the visioning. I mean, their staff, Atalaya's staff, helped us to vision, restructure this whole thing before we ever received the grant. We spent 9 months with AmeriCorps developing it. We have incredible support every single day from our portfolio manager and from her team. So don't be afraid. It really is fun to try something new and exciting, and so we are up to our eyeballs in it and loving every minute of it. We are presenting in the next session in Empire AB. Our portfolio manager's here. There she is in the hey, Sarah. We love to get to see her in person because she's usually just in the square in my, So enjoy the rest of the conference. Meet those 5 people. Stretch yourself. Make it 7, right? Do it. And enjoy the rest of the day, and we'll see you at lunch. Thank you.